Hi guys, today I'm going to talk about what do you need for intubation. So today's topic is what are the things you need to prepare before intubation. Patients who need intubation are usually very critical and you need to be tactful and quick so that you don't let goodbyes to happen between patient and their loved ones and you will save one valuable life. In a nutshell, timely intubation helps doctor and nurses to still lives and save lives. The first and foremost thing you need to prepare is endotracheal tube itself. Usually, endotracheal tube with internal diameter of 7 mm is used for adult female and 7.5 mm for adult male. Also keep it ready. The endotracheal tube of 0.5 mm is smaller and bigger than assumed size as there is always chance of exception to general. So keep ready 3 endotracheal tube of 3 different sizes in your intubation tray. Now let's learn about endotracheal tube in brief. The distal angled end is called bevel, which passes through vocal cord and trachea. Below bevel, in the lateral wall, there is opening called Murphy eye. If in case obstructions to bevel occur, then Murphy eye allows ventilation or gas exchange. Below Murphy eye, there is inflatable balloon called cough. After insertion of tube into trachea, cough is inflated and sealed against tracheal wall, which prevent tube dislodgement and aspiration of gastric content. This blue line throughout the length of the tube is a radiographic marker. It can be seen on X-ray and helps to visualize the tube placement. This is pilot balloon. Cough is inflated by pushing air into pilot balloon in an amount not to injure tracheal wall in a long term. This proximal end is called adapter, to which ventilator circuit is attached. There are lot of things you need to prepare before intubation and it's very difficult to remember all. So I have made a mnemonics quoted as my job is to still buys and save life. As we already discussed, our timely intervention or intubation still buys and save life. So mnemonics very much reflect our job. It will be very easy to remember as well. Let's see what's inside. The first we are going to explore is steel. S in the steel stands for stylet. T in the steel stands for tape for tube fixation. E is the ET tube itself and we have already discussed in brief about ET tube. A in the steel stands for ambu bag and marks. We ventilate patients before and in between the tube insertion with ambu bag and marks. After the insertion, we watch for bilateral chest expansion by ventilating patient from ambu bag. L stands for laryngoscope. We usually use sized 4 laryngoscope for adult. During preparation phase, we attach laryngoscope blade to its handle and watch if it is functioning or not. Again, do not forget my job is to still buys and save life. Let's explore what's in B in the buys stands for busy. For anticipated difficult intubation, busy is most essential. It is the flexible tube that helps in exploring the vocal cord and the path below. This is how busy is loaded inside the tube. Y in by stands for anchor suction. Some patients might have massive secretion which may block the visualization of the vocal cord. In that case, oral suctioning is done with anchor suction. So it is very essential to keep anchor suctions in your intubation tray before the intubation is started. E in the BICE stands for emergency drug. Emergency drugs like adrenaline, noradrenaline, phenylephrine, xylocard are the most essential thing which we need to keep ready before procedure as patients who need intubations are very critical usually. So S in the BICE stands for suction. We can use either portable suction or wall suction, but it is our duty to keep those things ready and check if it is working or not before the intubation is started. My job is to steal bikes and save lives. Now we are going to look into save. As in the save is SpO2 probe. We can use either probe of monitor or portable SpO2 probe. We need to monitor patient saturation before, during and after the procedure. So make sure SpO2 probe is available and is in working condition before intubation is done. A in the SAVE stands for anesthetic like ketamine and propofol, and along with anesthetic, muscle relaxant like rocuronium, becuronium can be used. So make sure these drugs are available. VE in the SAVE stands for ventilator equipments. After intubation, ventilation of the patient is supported by mechanical ventilator. So breathing circuit, Itmus exchanger HME filter need to be kept ready before intubation. Mechanical ventilator to provide positive pressure ventilation and test lung to test circuit and ventilator is most essential. Slogan of Lifesaver. My job is to steal lives and save life. Now let's look into L in the life stands for LMA. In case endotracheal intubation cannot be done and if we have to wait for expert to come for difficult intubation, we may intubate patient by LMA for a short time. Usually size 4 LME is used for adults. I in life stands for inflating devices. Inflating devices like syringe and cough manometer or anaeroid manometer is used. They are attached to the pilot balloon and air is pushed through pilot balloon to inflate the cough. F in the life stands for flexible bronchoscope. For a very difficult intubation anticipated early, it is wise decision to keep flexible bronchoscope ready. E in the life stands for esophageal tube. NG or OG is inserted immediately after endotracheal tube intubation to maintain and meet the calorie need of the patient. Our slogan is my job is to steal lives and save life. Now let's look into my job. We are going to look at last for the my job. So my stands for Magil forceps. We forget what's the thing that starts with M, then look into the Y as it already look like a forceps. It must be something forceps. So MY stands for Magil forceps. It is an angle forceps which is used to guide tube into larynx or NG tube into esophagus. It is also used to remove the foreign bodies. Now let's see what is inside the job. J in the job is for jelly and we use xylocaine jelly 2% to lubricate the distal end of endotracheal tube before insertion. O stands for oral airway and B stands for backup or help. As you alone cannot do all things on your own, you need help and many helping hands actually. So make sure helping hands are available before you start a procedure. Do not forget, my job is to steal lives and save life. So if you simply remember this, you can prepare the things for intubation quick and save life. Thank you.